What federal agency oversees the accreditation of phlebotomists? A. Health and Human Services. B. Center for Disease Control. C. National Institutes of Health. D. None of the above. What is the procedure for keeping a specimen under control from the time it is collected until the testing is finished? A. Patient control. B. Chain of custody. C. Specimen tracking. D. None of the above. What shade of tube should be used when taking a sample to check blood alcohol levels? A. Gray. B. Yellow. C. Red. D. Royal blue. Which of the following tasks is not within the phlebotomist's purview of practice? A. Identifying patients properly. B. Collecting a tissue sample. C. Labeling samples correctly. D. Drawing blood using the appropriate equipment. What component of blood is potassium EDTA able to bind to? A. Magnesium. B. Iron. C. Calcium. D. Azoic. E. All of the above. What is the procedure for keeping a specimen under control from the time it is collected until the testing is finished? A. Patient control. B. Chain of custody. C. Specimen tracking. D. None of the above. Which of the following can affect a blood sample if the patient refuses to fast when instructed to do so? A. Increasing stress hormones. B. Increasing enzymes such as creatinine and fatty acids. C. A false increase in analytes. D. Increasing its turbidity. What can happen if a needle is inserted where two veins diverge? A. Nothing. This is an ideal spot for venipuncture. B. An increased chance of a hematoma. C. Nerve damage. D. Failed venipuncture. What other name would you give a thrombocyte? A. White blood cell. B. Plasma. C. Platelet. D. Thrombus. Which of the following is the most typical reason for blood culture contamination? A. Improper storage. B. Improper site preparation. C. Improper transportation. D. All of the above. Which of the following is a potential capillary sampling complication? A. Scarring. B. Collapse of veins. C. Nerve damage. D. All of the above. Which of the following actions is required to correctly anchor a vein? A. Increasing pressure on the tip of the needle. B. Placing your thumb to the side of the vein and pressing firmly. C. Placing the thumb of your free hand below the vein and stretching the skin. D. all of the above. What should be added to a sample if it needs to be diluted? A. Preservative. B. Diluent. C. Anticoagulant. D. All of the above. Which of the following would result in a specimen being rejected? A. Insufficient quantity. B. Improper specimen. C. Incomplete chain of custody documentation. D. All of the above. What can happen if alcohol isn't given enough time to thoroughly dry during site preparation? A. Hematoma. B. Hemolysis. C. There is impact if the alcohol fails to completely dry. D. Hemoconcentration. The average amount of blood in an adult human being is how many liters? A. 10 liters. B. 5 liters. C. 3 liters. D. 2 liters. What should you do if you realize that a patient's name is spelled differently on the requisition and the patient's armband? A. Visit with your manager to verify the information and have it corrected. B. Ask the patient to go get the requisition corrected. C. Assume there was a typo and ignore the requisition. D. Any of the above. When do blood samples need to be labeled? A. After collection and after leaving the room. B. After collection in the patient's room. C. Just before venipuncture. D. In the laboratory. As an interface between analyzers and the hospital information system, third-party vendor software is employed, and it includes A. Middleware. B. Lease. C. Firmware. D. RAM. Which of the below tests may be carried out with serum or plasma samples? A. Monotest. B. HDL. C. LDL. D. RPR. All of the components of arterial blood gas that are often measured except A. PaCO2. B. PaO2. C. NH3. D. pH. Contrary to popular belief, one hormone lowers blood sugar levels while the other one raises them. A. Insulin, glucagon. B. Glucagon, insulin. C. Thymosin, glucagon. D. Insulin, glycogen. On obese persons, the vein that is easier to palpate is A. Median cubital. B. Median basilic. C. Cephalic. D. Basilic. A good blood smear should have all of the following except A. A jagged edge called a feather. B. Have a smooth transition from thick to thin. C. Cover 1, 2 to 3, 4 of the slide. D. be made from a blood drop 1 to 2 millimeters in diameter. Surgery, experimental medications, and other high-risk therapies require this form of permission in order to proceed. A. Expressed consent. B. Implied consent. C. Standard consent. D. Informed consent. If the radial artery cannot be utilized, which of the following should be the second option for arterial puncture? A. Ulnar artery. B. Brachial artery. C. Axillary artery. D. Femoral artery. Which of the following organs serves as the kidney's functional unit? A. Nephron. B. Ureter. C. Urethra. D. Glomerulus. This liquid covers the interior of the alveoli, reducing surface tension and assisting in wall stabilization. A. Pleural fluid. B. Plasma. C. Surfactant. D. Serum. All of the following are examples of connective tissue except A. Blood. B. Fat. C. Cartilage. D. Muscle. Which of the following does not have to be done when introducing yourself to a patient before collecting a specimen? A. If you are a student, tell the patient so. B. Explaining the test that will be performed on the specimen. C. Identify yourself and your title. D. Obtain consent for the collection from the patient. Which safety measures must be considered while treating a patient who has measles-like symptoms? A. Contact. B. Airborne. C. Reverse. D. Droplet. By turning on the extrinsic coagulation pathway, this drug can disrupt coagulation tests. A. Bacterial plastin. B. Prothrombin. C. Tissue fibrinogen. D. Tissue thromboplastin. The prefix of the word dyspepsia means A. Across, through. B. Difficult. C. Without. D. Against. An immature red blood cell with traces of a nucleus is referred to as A. Leukocyte. B. Erythrocyte. C. Respiratory. D. Thrombocyte. A healthcare organization that comprises of a group of hospitals that offer services from birth to death is A. Managed care organization. B. Preferred provider organization. C. Integrated healthcare delivery system. D. Health maintenance organization. Which of the following is used to ABG specimens as an anticoagulant? A. Citrate. B. Heparin. C. Oxalate. D. EDTA. Infant respiratory distress syndrome is characterized by a protein deficit, which results in collapsed alveoli in preterm newborns. A. Blood plasma. B. Surfactant. C. Pleural fluid. D. Oxygen. All of the aforementioned, with the exception of A. Be made from a blood drop 1 to 2 mm in diameter. B. Have a smooth transition from thick to thin. C. A jagged edge called a feather. D. Cover 1 2 to 3 4 of the slide. The question is asking which testing options are classified as waived testing by CLIA standards. A. Complete blood count. B. PCR testing. C. Blood glucose for home use. D. Microscopic examination for the presence of bacteria. Pink or red stopper tubes can be utilized for blood bank purposes. A. True. B. False. The magnification system of a microscope does not include the following item. A. Arm. B. 10x objective lens. C. Ocular lenses arm. D. 4x objective lens. The governmental agency responsible for overseeing public health care in the United States is A. Center for Disease Control and Prevention. B. Department of Health and Human Services. C. Food and Drug Administration. D. Clinical and Laboratory Standards Institute. The specimens collected from patients in contact isolation should be A. Collected in duplicate. B. Double-bagged. C. Delivered to microbiology. D. Collected wearing sterile gloves. Cryoglobulin testing is a method used to measure the level of certain antibodies in the blood. A. Screen for rheumatoid arthritis. B. Screen for systemic lupus erythematosus. C. Help diagnose Raynaud's syndrome. D. Diagnose syphilis. Increased hemoglobin F improves oxygenation in cells harboring, decreasing those cells' vulnerability to sickle. Which hemoglobin protects people with HBS from sickling? A. Hemoglobin A2. B. Hemoglobin C. C. Hemoglobin F. D. Hemoglobin G. With the exception of, lavender stopper tubes may be used for all of the following. A. Hematocrits. B. Coagulation tests. C. Differential counts. D. Platelet counts. The electrolyte panel, consisting of potassium, sodium, chloride, and carbon dioxide, is typically ordered within other panels. The components of an electrolyte panel lights, Chem4 are A. Potassium, sodium, chloride, carbon dioxide. B. Potassium, sodium, chloride, glucose. C. Potassium, sodium, chloride, creatinine. D. Potassium, sodium, chloride, bun. The suggested tube to use while collecting blood samples from patients on anticoagulant treatment is A. Yellow, gray, or orange. B. Red. C. Light green. D. Red, gray, or gold. Which of the following organizations has created guidelines to ensure that clinical laboratories perform to the best standards possible for patient care? A. Joint Commission. B. Centers for Medicare and Medicaid. C. Clinical Laboratory Standards Institute. D. Occupational Safety and Health Administration. When using peptone and only fermenting glucose, TSI responses tend to be more alkaline than acidic. On triple sugar iron agar, which of the following sugars has been fermented by a gram-negative rod, producing an acid but and an alkaline slant? A. Lactose. B. Sucrose. C. Glucose.